If you are a woman over 70 and you feel a tightness in your chest after climbing a few stairs, walking to the mailbox, or doing something as simple as carrying groceries, do not ignore that. Most doctors will brush it off as just aging, but there are real specific reasons why this is happening to your body, and some of them are more serious than you think. That tight feeling in your chest after a small amount of movement, it feels almost like someone is pressing on your chest from the inside. Maybe it goes away after a minute or two. Maybe it leaves you a little short of breath. And maybe you've been telling yourself it's nothing because it always goes away. But here's the thing, your body is giving you a signal. And in this video, I'm going to explain exactly what is causing that feeling, which ones you need to take seriously, which ones are manageable at home, and what actually helps. By the end of this, you'll know more about your own heart and lungs than most people twice your age. Let's talk about what's actually going on. When you were younger, maybe in your 40s or 50s, you could walk up a flight of stairs and feel completely fine. Now, just going from one room to another sometimes makes your chest feel heavy or tight. And it's confusing, right? Because you're not doing anything extreme. You're not running a marathon. You're just living your life. This is one of the most common complaints among women over 70, and it's one of the most misunderstood ones too. Here's why it gets missed so often. The symptoms in women are very different from the symptoms in men. When most people think of chest pain or heart problems, they picture a man clutching his chest dramatically. But in women, especially older women, the signs are much more subtle. It might just feel like pressure or heaviness or a kind of fullness in the chest that comes and goes. And because it's subtle, a lot of women wait. They wait months, sometimes years, before they say something to a doctor, and that waiting can be dangerous. So let's stop waiting and start understanding. There are several different reasons why a woman over 70 might feel chest tightness after small physical activity. Let's go through each one carefully. The first reason is changes in the heart muscle itself. As we get older, the heart muscle gets stiffer. It doesn't relax as easily between beats. This is called diastolic dysfunction, but you don't need to remember that word. What you do need to understand is what it means. Your heart has to work harder to fill up with blood and push it out. So when you do anything physical, even something small, your heart is already working near its limit. That's when you feel the tightness. This is incredibly common in older women. In fact, studies have shown that women are more likely than men to have this type of heart stiffness as they age. It's not a heart attack, but it is a real condition that needs attention. The second reason is something called angina. Angina is when the heart muscle doesn't get enough blood during activity. There are blood vessels that supply your heart with oxygen-rich blood. When those vessels are narrow, from years of plaque building up, they can handle your heart's needs when you're resting. But the moment you start moving, your heart needs more blood. And if the vessels are too narrow to deliver it, you feel chest tightness or pressure. This usually lasts a few minutes and goes away when you rest. That pattern, tightness during activity, relief when you stop, is a classic sign of angina. Angina is not a heart attack, but it can be a warning sign that a heart attack could happen in the future if it's not treated. That's why it's important to tell your doctor if this is what you're experiencing. The third reason is low blood pressure response to activity. Some older women have blood pressure that doesn't respond the way it should during exercise. Instead of going up slightly to push blood where it needs to go, it might drop or stay too low. When that happens, the heart and chest area can feel tight or uncomfortable, and you might also feel dizzy or a little faint. This is more common if you've been on blood pressure medications for a long time, or if you've been less active in recent years. The fourth reason involves the lungs. Not all chest tightness after activity is about the heart. Your lungs play a big role too. Conditions like COPD, which is a type of lung disease caused mainly by years of exposure to smoke or air pollution, can cause chest tightness after even light activity. Asthma in older adults is also very real and very underdiagnosed, especially in women. When your airways narrow even slightly, moving around uses more oxygen than your lungs can easily deliver. The result is that tight, sometimes breathless feeling in the chest. If you've ever smoked, even years ago, or if you grew up around a lot of smoke, this could be part of what you're experiencing. The fifth reason is anemia. This one surprises a lot of people. Anemia means your blood doesn't carry enough oxygen. Red blood cells are what carry oxygen around your body. When you don't have enough of them, your heart has to pump faster and harder to make up for it, especially during activity. That extra effort can feel like chest tightness or even chest pain. Anemia in older women often happens because of poor iron absorption, vitamin B12 deficiency, or chronic conditions that affect blood production. A simple blood test can find this. The sixth reason is stress and anxiety. Yes, emotional stress causes real physical chest tightness. And this is something that gets dismissed too often in older women. When you're anxious or under stress, your body releases hormones that tighten your muscles, speed up your heart, and make your chest feel heavy. If you've been dealing with loss, a spouse, a friend, changes in your independence, your body carries that. This doesn't mean the feeling is all in your head. It means your mind and body are connected, and emotional pain has a physical address in your chest. The seventh reason is musculoskeletal issues. Sometimes what feels like chest tightness is actually coming from the muscles, joints, or ribs around the chest wall. As we age, the cartilage between our ribs and breastbone can become inflamed. This is called costochondritis, and it can cause a tight, achy feeling in the chest that gets worse when you move around. This kind of chest tightness is usually not dangerous, but it can be painful and confusing. Now, here's something very important I need to say clearly. Some chest tightness during activity is a warning sign. There are certain signs that mean you should not wait for your next scheduled appointment. You should call your doctor today or go to the emergency room. Those signs are chest tightness that spreads into your left arm, your jaw, your neck, or your back. Chest tightness that comes along with sweating, nausea, or feeling like something is very wrong. Chest tightness that lasts more than 15 to 20 minutes and doesn't go away with rest. Chest tightness that is getting worse over time, happening more often, or starting with less and less activity. In women, a heart attack doesn't always feel like the dramatic chest-grabbing moment you see in movies. It can feel like pressure, or indigestion, or just a deep tiredness combined with chest discomfort. Please don't talk yourself out of these symptoms. Now let's talk about what actually helps. Because information without action doesn't do much good. The first and most important step is getting properly evaluated. Before anything else, you need to know which of these causes applies to you. A doctor can run tests, an EKG, an echocardiogram, a stress test, a blood test, that can tell you exactly what your heart and lungs are doing. These are not scary or painful tests. They give you real answers. And once you have real answers, you can take real steps. Don't let a doctor brush you off with, it's just your age. Age changes the body, yes, but chest tightness during activity is something that deserves to be investigated properly. The second step is gentle, consistent movement. This might sound backward. If movement causes chest tightness, why would you move more? But here's what the research shows. A sedentary lifestyle actually makes the heart stiffer and the lungs weaker over time. Very gentle, supervised activity, like a slow daily walk, helps the heart and lungs become more efficient. Over weeks, the chest tightness often gets better, not worse. The key word is gentle. You are not trying to push yourself. You are just trying to keep things moving. If you have been diagnosed with any kind of heart condition, ask your doctor about cardiac rehabilitation, which is a supervised exercise program designed specifically for people with heart issues. It is one of the most effective tools available, and far too few women use it. The third step is paying attention to what you eat and drink. High salt intake causes the body to hold onto fluid, which puts more pressure on the heart. If you've ever noticed that your chest feels heavier after eating a salty meal, that's why. Cutting back on salt, not eliminating it, just reducing it, can make a real difference for how your heart handles everyday activity. Staying well hydrated is also important. Dehydration makes blood thicker and harder for the heart to pump. Something as simple as drinking enough water throughout the day matters more than most people realize. The fourth step is managing stress actively. If anxiety or emotional stress is contributing to your chest tightness, and for many women it is, then addressing that stress is part of treating the symptom. Deep breathing exercises, where you breathe in slowly for 4 counts, hold for 4, and breathe out for 6, activate your body's calm down response and can reduce chest tightness within minutes. Gentle yoga, meditation, or even just spending time with people who make you feel safe, these are not small or silly things. They directly affect how your nervous system responds to activity. The fifth step is reviewing your medications with your doctor. Some blood pressure medications, diuretics, and other drugs commonly prescribed to older women can affect how the heart and lungs respond to movement. If your chest tightness started or got worse after a medication change, that conversation is worth having. Never stop a medication on your own, but always ask questions. So let's bring this all together. Chest tightness after small physical activity in women over 70 is common. It is not something you just have to live with. It is your body telling you something. And the message is almost always, I need a little more support. The causes range from heart stiffness to narrowed blood vessels, to lung conditions, to anemia, to anxiety, to muscle inflammation around the chest wall. Some of these need medical treatment. Some are helped by lifestyle changes. Some are helped by both. What matters most is that you don't ignore it and you don't assume it's nothing just because it seems mild or because it always goes away when you rest. Get evaluated. Start gentle movement. Reduce salt. Drink more water. Manage your stress. And have honest conversations with your doctor about what you're experiencing. You've spent your whole life taking care of other people. Your heart deserves the same attention.